Members of the House of Representatives Press Corps have been enrolled into the Federal Capital Territory Health Insurance Scheme following the sponsorship of one-year coverage for the journalists by the chairman of the House Committee on Media and Public Affairs, Akin Rotimi. The symbolic presentation of enrollment identity cards took place at the National Assembly complex, with stakeholders describing the intervention as a milestone in strengthening journalists' welfare and supporting Nigeria's drive towards universal health coverage. Speaking at the event, Rotimi said the initiative was anchored on the commitment of the 10th Assembly to strengthen engagement with the media and support the well-being of journalists covering legislative activities. He acknowledged the support of the Speaker of the House of Representatives of Nigeria, Abbas Tajuddin, noting that the Press Corps plays a critical role in the country's legislative process. He said the intervention recognized the demanding nature of journalism, particularly for reporters who work long hours covering parliamentary activities. Rotimi emphasized the importance of preventive health care and encouraged beneficiaries to prioritize routine medical screening and early detection. He explained that the initiative was designed to provide sustainable health care access while encouraging wider participation in health insurance coverage across society. He explained that the initiative was designed to provide sustainable healthcare access while encouraging wider participation in health insurance coverage across society.
So I would want to encourage every one of us to take advantage of what it is that the Right Honorable Abbas Tajuddin-led House of Representatives has done. For the women, your breast cancer screening, cervical cancer screening. For men, you want to do your prostate screening. You want to do your annuals and take them very seriously. You do a lot of work. And I know sometimes up until 9, 10 in the night, they take a lot of time doing this work. And sometimes you just get home, you're tired. You don't prioritize yourself trying to ensure that you are doing your constitutional mandate. But sometimes you have to look out for yourself.
In her remarks, the Mandate Secretary of the FCT Health Services and Environment Secretariat, Dolapo Fashawe, described the sponsorship as a significant contribution to expanding healthcare access. She was represented by the Permanent Secretary, Dr. Baba Gaba Adam. She said the intervention supports the FCT Health Insurance Scheme's Adopt and Enroll program, which encourages individuals and organizations to sponsor health insurance for others. Fashawe noted that the scheme provides access to quality healthcare services at an annual premium of 22,500 naira per person and urged other leaders and institutions to emulate the example.
Call on other leaders, institutions, and kind-hearted Nigerians to emulate this worthy example by distinguished Honorable Akin Rotimi. With just 22,500 per individual per year, anyone can enroll a person into the FCT Health Insurance Scheme and give them access to quality healthcare services. I would like to thank the chairman of the Press Corps and other executives who gave us unalloyed support to achieve this great idea.
Chairman of the House Committee on Nutrition and Food Security, Chike Okafor, described the intervention as historic and commended the leadership of the 10th Assembly for supporting the initiative. He said health insurance remains one of the most effective mechanisms for expanding healthcare access and improving welfare outcomes.
With just 25,000, that's what I think I had. 22,500,000, you will enjoy free health care for the next 12 months. Now, what actually got me attracted, beyond the fact that I understand what health insurance is all about, in the 8th Assembly, I chaired the Committee on Health Care Services, and we oversighted the then National Health Insurance, NHIS, and of course the FCT, FHIS. So I understand what it means. Between 2016 and 2019, in my constituency alone, I paid and covered over 12,000 lives.
In a goodwill message, Chairperson of the FCT Council of the Nigeria Union of Journalists, Comrade Grace Ike, said the initiative underscored the importance of journalists in democratic governance. She said improved welfare could strengthen professionalism and accountability in the media. Ike added that the initiative strengthens democratic engagement by supporting those who provide credible information to the public.
Let this investment in our well-being translate into renewed dedication to excellence. To the House leadership, I say thank you for leading by example. To my colleagues in the House of Reps Press Corps, we set the pace. Let us continue to rise to the moment and justify this confidence placed in us. Nigeria depends on a strong legislature, and at this time, Nigeria also depends on a responsible media. Democracy thrives when the media is healthy and alive to its responsibilities. So, working together with the legislature, we can strengthen our democracy.
Chairman of the House of Representatives Press Corps, Gboyega Onadiran, described the program as a practical step towards universal health coverage in Nigeria. He expressed appreciation to Rotimi and the FCT Health Services Secretariat for the collaboration that made the initiative possible. Onadiran urged organizations and professional bodies to prioritize the health of their members by embracing structured health insurance schemes.
And we strongly believe that where leaders start and the successor takes over, it's only very important that the successor builds on what the predecessor was working on. Your support reinforces the message that healthcare should be inclusive and accessible to all. Distinguished guests, honorable colleagues, Nigeria is steadily advancing towards the goal of universal health coverage, a system where every citizen has access to quality healthcare services without suffering financial hardship. Today's initiative is a practical step in that direction. It demonstrates that achieving universal health coverage requires partnership, commitment, and deliberate action.
Participants described the intervention as a demonstration of how legislative leadership, health authorities, and the media community can collaborate to advance public welfare while strengthening democratic institutions. Uchi Jacinta, Eagles TV.